Great. Thank you for those kind introductions, and thank you for inviting me to speak. My name is Chris Willcox. I'm an organizer with St. Louis Mutual Aid, and I work for a Red Circle, which is a nonprofit that serves North St. Louis County. My history with healthcare systems in America comes from the perspective of both receiving services and from providing them. I was first diagnosed with anxiety and depression in college before I graduated in 2011 at the peak of the Great Recession. Getting treatment for depression suddenly made a lot of struggles in my life make sense. The thing about depression is that the simplest things, such as getting out of bed, can feel incredibly difficult. And it can be hard to even imagine that there is anything worth getting up for. Adding to that, failing to overcome challenges makes it all the easier to gather what feels like a cumulative body of evidence of your own worthlessness. We deal with arbitrary disruptions in healthcare because of our dependence on private health insurance companies and struggles with precarious employment. I've had to change therapists at least 3 times because the ones I was working with was no longer a network. When I was temporarily uninsured or had to start with a new insurer, I've had to go through withdrawals multiple times because of denials or delays, prior authorizations, or any other bureaucratic headaches we spend hours and hours of unpaid time dealing with. In my experience working in social services, the limitations of existing public health insurance left many of my clients' needs unmet. Many agencies operate by churning as many billable services as possible from underpaid and poorly supported staff. Imagine being worried about making your numbers while trying to be present for a client that is telling you about their suicidal ideation. One client I worked with was particularly ill-served. She had to borrow money from her brother to get her medications while she waited on Medicaid to establish her coverage. I was advised to reschedule her appointments so that I could pick up others to get my numbers up because she would frequently have to reschedule. Understandable for someone needing treatment for serious mental health challenges. The very day I was given this advice, the same client texted me a call for help as she was struggling with suicide. After I intervened, she went to the hospital for the 2nd time for suicide because before she was finally granted coverage by Medicaid. This was while I was having my own thoughts about suicide related to the conditions of my job, but I had put off seeing a therapist for several months because during that time, I was hired late in the year and I would have to pay entirely out of pocket to have the deductible reset in January. These problems exist simply because we choose not to make the commitment to care for every person who needs it. This may be even more the case in mental illness, which can be every bit as lethal. It takes courage and resolve just to seek treatment, as fear of being seen as weak or as making it up in your head only adds to the barriers we've already put between people and care. Without getting the care I needed, I might not even be alive today, let alone speaking to Congress about finally getting the support our people need and deserve. We know what we need to do to make sure that everyone gets the care that they need. Medicare for all now. Thank you.
Thank you. The gentleman yields.